In this module, you will learn about evidence-based medicine as it applies to child and adolescent mental health. It's largely based on chapter A6 of the excellent Yakapap e-textbook, which you will find when you Google it. And I will always recommend you to read the whole chapter if you want to learn more. What are we going to do in this session? Well, you're going to learn to understand basic and relevant statistical concepts. You're going to learn to use good diagnostic interviewing techniques in order to choose the best treatment for your patient. You will also learn to translate clinical questions and dilemmas into answerable so-called PICO questions. You will learn to search databases electronically, which is available at no cost at all. And you will learn to troubleshoot to find treatments most likely to help your patients within your constraints. Why would you need to do this? Well, we have a very big challenge at the moment. Child and adolescent mental health problems are actually one of the largest contributors to the global burden of disease in young people. And we need to evaluate very carefully what to do to create more reliable evidence, as very little evidence is actually available, for example, from low and middle income countries. But we do have a lot of evidence already, so we need to understand the most promising evidence we do have in order to improve child and adolescent mental health anywhere. So let's start by looking at some statistical concepts. The biggest enemies of the truth are called random error and bias. Now, what is a random error? Imagine you want to measure how far 6-year-olds can throw a ball, and you ask a number of schools to try it out. Now, almost every teacher who will measure the results will make some mistakes in their measurements. Some might measure too short, some too long. Sometimes the field is not quite even. And so you get a variety of results. But you can imagine if your sample is big enough, you will get the end result approximately correct if only you have managed to take a sample which is big enough. But now imagine you go to only one school where there are enough students to test, but you find out at the end of the afternoon that the wind on that day actually came from behind for all these children. So what will happen is that you have made a systematic error in your measurements. Maybe all children will have thrown much longer than they usually would. That is called bias or systematic error, and you need to watch out that this hasn't happened in a study that you read. How could that happen in science? Well, imagine a study tries to compare two treatments, and they have trained the staff in one clinic to use a certain new treatment, and the other clinic hasn't been trained. Now imagine the clinic that has been trained is in a very rich part of town where there are lots of factors that might contribute to these patients getting better. For example, better food, better facilities, etc. Whereas the other clinic was in a poor part of town. So you might not be talking about the treatment at all when you compare results. So it's always good to actually see whether the treatment group and the control group have actually been randomly allocated so that children have the same chance to have either the treatment or control. There are other effects, for example, placebo effects of treatment, which means that children and parents who expect a certain treatment to be better than another will actually also get better. So very often, even if you give any pill, there will be a certain amount of improvement. So it's always good if children and parents do not know whether they are actually getting an active treatment or a placebo pill. That means they are blind to the treatment. And there are other factors which you need to look out of, for example, whether the doctor who gave the treatment is also blind to the treatment. We call that a double-blind study. And whether all children have been followed in follow-up, or whether maybe the ones where the treatment didn't work so much never answered the final questionnaire, and so the treatment looks to have worked much better than it actually did. Another set of statistical concepts, which you will find in almost any study, is those relating to a normal distribution or Gauss curve. This is a curve which you see on the picture, which will show you about a trait which is normally distributed in the population, for example, something like height or intelligence. And you will find that the mean value in such a curve is the one that most commonly arises and which is right in the middle. You will also see the dark blue areas on this curve, which show you one standard deviation. Now, this is defined as being about 34% of the population on either side of the curve. 2 standard deviations is the lighter blue area. Now, when we talk, and the standard deviation shows you a little bit about the variability in a sample. So you can have a curve which is quite steep, which will show you a trait which is not so variable. If it's quite flat, you will have a long range of normality. When comparing treatments, you will often read about the effect size, and that relates to the standard deviation. So if an effect size is half a standard deviation, you now know what it means, that the treatment group has moved on this standard deviation by half a measure, and that is a rather large effect size. Now, the next step is that in order to actually find the right treatment for your patient, you need to arrive at a valid and reliable diagnosis. So the child that you diagnose with a depression actually has to be quite similar to the one with depression which is talked about in your studies. We call something reliable if the tests you use are actually good even if they're used by different raters, so that is called inter-rater reliability, and if they come out with the same measures time and time again on the same patient. It also needs to be valid, so you actually have to measure what you want to measure. And so quite often, so if you measure only concentration, if you want to find out whether a child has ADHD, that might not be enough because a child might be unconcentrated because they are depressed. So that wouldn't be a very valid measure. You will need to add more items to your measurement. A good clinical training will usually teach you to arrive at valid and reliable diagnosis, but not always. So it's good to use extra checks, and to do that you can use questionnaires, which sometimes are freely available on the internet, and you can find links to those in the Yakapap textbook, which I mentioned before. And you will also see that some of the questionnaires will be for screening, and some will actually be to make a diagnosis. You need to be aware which one you're using. In a screening questionnaire, you will usually pick up a lot of patients who don't actually have the disorder, which is a good thing because you want to test, you don't want to miss anybody. And in a diagnostic questionnaire, that will be much more careful, and you will actually only try to hit the patients who actually have the problem. You need to be aware, however, that if you use questionnaires, the questionnaire might not actually be validated in your country or in your culture. So there might be questions which, in one context, could be quite pathological, for example, not making eye contact, where in another country that might be quite a normal thing. So be careful to only use questionnaires that are validated. And if you do use questionnaires that are not validated in your country, use them with caution. They may still be useful, for example, if you want to test the results of your treatments, but don't usually use them to make a diagnosis. Semi-structured interviews are another very good measure. Again, some of them are freely available. Others you will actually need to be trained in order to use them. In those interviews, usually the interviewer does not have to ask every single question. They will ask a probing question at the beginning, and then they can home in on the actual result. So, for example, if you ask about social relations in a child, you might ask whether they have friends. Once you find out that they have a lot of friends, that they are regularly invited to birthday parties, and that they generally get on with other children, you don't have to go into detail in all the questions about this or in all the questions, for example, of autism, because it's unlikely that this child will have such a disorder. Even if you haven't been trained in the specific use of the questionnaires, it's still good to have a few probing questions in order to use your time economically. Now, what do you do if really most of the instruments available have not been tested in your country? Well, use the most basic questionnaires, don't overinterpret the results, aim to use questionnaires that are really just asking the questions in ICD or DSM, because they are usually more simple. And contact researchers in your country to see whether they are maybe busy in validating certain questionnaires. Maybe you can even join their studies and contribute to the knowledge available around. Now we will look at the pyramid of evidence in order to make it even easier for you to search the internet and to find the most suitable treatment. There are studies which you see in the middle of the pyramid, which usually are just reporting on one single study. And the highest of those is the randomized controlled trial, like we've discussed earlier. On the top of the pyramid, you find studies that are actually summarizing or evaluating several similar studies from around the world. So they are called meta-analysis or systematic reviews, and their level of evidence is even higher. And on the bottom of the list, you find reports of single cases or clinical experience, which sometimes still is very useful, even though it's of less high quality as evidence to everybody. Now, what do you need to do when you want to search the best treatments? The main things are to remain curious and actually go on a search. And you can do that with the help of a number of databases. I will give you an example. Imagine you see Ahmed. He's a bright 10-year-old with ADHD. You've already spoken to his teacher and his parents. You have implemented some psychosocial measures, but he still cannot concentrate. He's very disruptive in class, and the teachers really threaten to dispel him from school. So now you think you want to use some medication. You have heard that stimulants like methylphenidate are very useful, but they're not available in your country. But you have also heard of medications like clonidine or imipramine, which might be able to help. But should you actually use them, and which one? First of all, you have to put this clinical dilemma into an answerable question. We call that a PICO question. You look, what is the specific patient or problem, a 10-year-old with ADHD? What is the intervention? You're looking for medication, clonidine or imipramine. What is the comparison which you want to find? Which medication works better? And for which outcome? For concentration and not disrupting the class. You search for it, you critically apply what you find, and you integrate that with your clinical experience and the values and resources. Now, I've done this on this problem, and you just go to PubMed, you click on Advanced, type in ADHD in the builder, and you search. Now, there are loads of hits, 27,000 on the day I did it. You'll have a different number. Now you go back and you add clonidine or imipramine to your search. You still get more than 12,000 results. Now you can start by setting your limits. I did so by looking at the highest level of evidence, the meta-analysis. I also only want to know about humans. I want the results to be in English, and I want them to apply to children. Having done that, I get 14 hits. Now, 14 articles are quite easy to screen. Screen them, read them, look at which apply to your patients the best. Check the methodology of the articles, because you can do that now, and then take your decision based on your patients and your results. If you have too few hits, just expand the search again. Include some more systematic reviews or RCTs until you find what you need. So the take-home message is, keep search strategies transparent and clear, monitor how many hits result, and allow to adjust your data in order to fill your search purposes, your resources, and your time and interest. If you only want to find results on one patient, it can be quicker than if you want to write guidelines for your country, for example. What if you actually find a very good therapy, but you don't have it in your country? Well, that happens. You might want to give your patient cognitive behavior therapy, but you don't have a therapist available. Especially in low and middle income countries, that can happen. Now, sometimes you need to look for articles from your country, which might not be so high on the list of evidence, to see whether there is another option that you can use. Sometimes you need to check with your local centers, universities, if they know of something available for your circumstances. And sometimes you just need to adapt your treatments and resources, or you have to contribute. So let's do some troubleshooting again. Imagine you have done all your searches and you find that there is a very good therapy for your patient, but that's just not available in your country. What can you do? Well, evidence shows that in low and middle income countries, many complex treatments can actually be stripped down to basic principles and can still be very effective. Check reviews or articles from low and middle income countries to find something which might be more realistic for your circumstances. Look at local evidence, even if it doesn't fully apply, and even if it doesn't meet the highest research standards. And check with local centers, the WHO or UNICEF, whether they have maybe already got adapted programs available. And finally, try to adapt the treatment yourself. Publish your results so that you will contribute to the evidence base. What about if you feel that in many of the published studies, too many exclusion criteria are used? The patients are very pure. They don't have any social problems. They only have one diagnosis. And you think your own patient might be much more complex. What shall we do then? Well, make a list of all the various problems and diagnoses your patient has. Set priorities about which problem to address first. Ask the family and the patient themselves where they want to start. And start with a small, realistic aim, and then just go on to address one problem at a time. So what's the role of the clinician in all that? Can we not just do that through internet searches? Well, no, actually we can't. The clinician is crucial because you have to integrate what you find in the literature with the real situation of the patient, with their own values and beliefs. So even if the evidence shows that medication might be very suitable. If the patient and the family don't believe in it, you cannot use it, and you need to start with psychotherapy. Sometimes there are different assumptions of how boys or girls should behave, what is normal and abnormal. You need to take that into account. You also need to look at the role of the extended family. Who's making treatment decisions in your culture? Maybe you need to talk to grandparents, aunts and uncles, as well as to the parents. And don't underestimate the influence of the internet, which can be very good, as well as misinforming. Ask people what they are reading. So, let's summarize. What's the take-home message of this module? Well, the first one is use the best available evidence to find a suitable treatment for your patient. Read the literature critically, but also be realistic. Not for every situation there is an RCT available. Integrate the information from the pyramid of evidence with locally available resources and practices. If you find that the evidence is insufficient, evaluate what you do and whether it helps. Do this at an individual patient level, but also more broadly. In that way, you can contribute with your work to the much needed evidence base. So, continue to keep looking carefully and don't be blinded by first impressions. You might miss something important in the background. Stay curious. Thank you.